I've been at home most of the time, and my family were quite strict towards me when I go out. And then they advise me to go out only when I want to buy food or home house item. How about you, bro?
Oh yes, bro. Your parents were right. We couldn't even meet our friends or relatives during MCO because the virus could be anywhere and we could get infected if we are not careful. I have been at home too, bro, helping my parents doing house chores, cooking sometimes for my family.
Oh, you're cooking! You're cooking! Oh. No, bro. Actually, yeah. Me too, bro. I'm at house. I'm at my house to cook, and then I practice to cook. Yeah. Then we cook, we can improve our skill.
Yeah.
Hello guys,
Hello, guys.
guys.
Welcome, Rafi.
Rafi.
Welcome, Iqbal. Have a seat, guys.
Thank you.
Okay, good morning, Doctor, and to all of you. We are glad to have you here with us. So, Doctor, how are you just doing onto the MCO period?
About that, before I start, thank you for inviting me. Morning. During the MCO, it was a hassle for me because I was in charge in the ward patient for COVID-19. I couldn't meet with my friends or my family because it was a hassle in the hospital. So I just spent my time in the hospital and just talking with my family through Zoom and video calls. So yeah.
Doctor, that can be the most saddest part. Just being in the hospital the whole time and not getting a chance to meet your family. Absolutely, it's heartbreaking moment. So, doctor, from your overview, from all this, what can be the cause of the spreading virus through our community?
I think from my overview,
Yeah, Doctor, thank you, Doctor. We have to make sure to follow the social distancing rule all the time. So, like Peter said and our family said, so we also have our COVID survivor here with us, Rafi and Iqbal.
Yeah.
Then we are glad and happy to see you both here with us. Firstly, how did you both even got hit by the virus and how did you both
Diagnose
it? Yeah.
Hi, good morning.
Good morning.
Thank you for inviting me and my friend here today. To be honest, myself and my friend, we are close buddies. To be honest, myself and my friend, we are close buddies. Wherever we go together. And of course, as we put on our mask. And follow the SOP rules. We used to do lunch together. We have a mask on. There was a day, he was eating and when another customer came in and his temperature was higher than 37.5. Then the customer wasn't allowed to come into the shop.
Oh my god, the story sounds interesting. Then what happened?
Also, yeah, after that, the one who got was I actually had 2 days of cough and dry throat. As I know was already getting tired day and but I didn't focus on it. I thought it was just a normal flu. But at the end, I knew it was all because of this sick.
So be aware, guys. Make sure you guys go on right track and keep yourselves safe. So thank you, Dr. Zafri, for joining us, and thank you for Rafi and Iqbal for joining us. And thank you for Dinesh with me and with our host for today. We will come with a new interesting topic on next week. Thank you, guys.
I'm Dinesh. I'll be here vaccine for coronavirus, nor is there any medications that can treat it. And no anti-malaria drugs don't work either. They actually heighten the risk of cardiac arrest, putting you at much greater risk of fatal coronavirus infections. Because there are no current medications and because hospitals are so overrun with patients that those with mild symptoms are actually at greater risk of harm if they go to a hospital. The best thing you can do to protect yourself is avoid getting sick in the first place. To do that, you need to stay home, keep your kids at home, and avoid going out whenever it's possible. And eliminate contact with individuals outside your house. Unless strictly necessary, such as example, you need to go to a pharmacy or you need to take your medication from the clinics, then you have to go by your own if it's possible, or you can just call them and ask them to send it to your home. Yeah, that's all. Okay, we understand this is not possible for every worker. Some workers cannot complete their work from their own home. For this reason, employees are encouraged to be as flexible as possible to minimize the risk to workers and their families. Okay. Secondly, you have to wash your hands. Okay. If you have to leave your home, washing your hands is the best way to protect yourself. Even if you don't leave your own home, washing your hands often is encouraged to eliminate bacteria, harmful bacteria. Wash your hands after going out as well, after you're handling things that you have touched outside your house or after doing chores. The CDC recommends us using soap and water to wash our hands whenever we can after handling things or after doing any work or before we touch our faces, we have to wash our hands. It's to eliminate the harmful bacteria from our hands. If you don't have access to soap and water, you can use hand sanitizers. They should only be used if you are out in the community and do not have access to soap and water. Okay. When washing your hands, wash truly for at least 20 seconds. Such as if you could sing the happy birthday song for 20 seconds for you to wash your hands truly. Okay, thirdly, disinfect surfaces. Okay. Finally, washing your hands won't do much good if you immediately touch something covered in germs, such as this table over here. It's we don't know if it's with germs or what, and we'll just touch it like that. Okay. For example, it is 10 times dirtier than a toilet seat. To that end, you should regularly disinfect surfaces in your own home, such as using hand sanitizers or anything that would clean the surfaces, wash it, wipe all the surfaces, and it's about weekly, twice or 3 times. You should pay extra attention to objects and surfaces that are touched often, such as the TV remote, your handphones, laptops, water bottles, and your car, steering wheel, desk, tables, light switch, keyboards, and toilet. You should use soap and water before disinfecting them. Yeah. And yeah, that's it. Okay, so thank you.
My name is Muhammad Zamri bin Muhammad Izzuddin, and today I'm going to give some tips for the senior citizens to always stay safe during the COVID-19 pandemic. First of all, always stay at home and do not go visiting. Get your neighbors, friends, or even your family members to help you with your errands if you are required to leave your home, such as grocery shopping. If you have no one to help you with, there are supermarkets. They are offering specific times for only older adults to shop. So do take this advantage of this session. Not only that, avoid large gathering, crowds, and public transport. This includes taxis and e-hailing cars. Next, always abstain yourself from physical contact, such as shaking hands or hugging each other. Always keep your distance at least 3 feet or 1 meter away apart from your friends, your family, or even your neighbors. For the final point, if you have to leave your home, please always wear your mask. Avoid touching your hands, avoid touching your face, and wash your hands thoroughly with soap and warm water, and sanitize yourself always at any times once you return home. Second point, always follow expert advice and guidelines. As pandemics are not new to the world, several best practices for action have been recommended by the World Health Organization. You should be familiarize yourself with this kind of guidelines, as well as those who are issued by the government, and follow them. For instance, WHO provides a specific advice on how to properly wash your hands. Not only that, do ask for assistance if you need help to wash your hand properly, if you have due to condition like Parkinson's disease. And for that, frequently wash your hands with warm water and soap for at least 20 seconds. Or you should clean your hands with an alcohol-based sanitizer if they are not visibly dirty. And do not forget, do disinfect or sanitize. Do disinfect and sanitize and frequently touch items such as doorknob, railings, and money. That's all for me. Thank you.
The next point is about avoid unnecessary travel. If you want to go or plan any travel, you just cancel, because during MCO COVID-19 we do not go any country because we don't want to spread out virus COVID-19 in our country, Malaysia. So we must follow the rules that we do not to go travel. Okay. And then the second, we must avoid going out to visit our children or grandchildren or our family, because we don't want to spread out to for our family, because we want to stay safe, stay healthy. That's why we must stay at home. And then for the social, we must social gathering, community prayers, religious gatherings or class weddings and funerals are also to be avoided as well. Because we don't want to be a cluster. We don't want to be a cluster because we want to take care of our country spread out from the virus. So stay safe, guys. And lastly, even if you are feeling perfectly well, just precautions are crucial to staying safe and healthy at home. Another point is keep update about the disease. With any pandemic, we should always keep up to date with the latest findings about the disease, especially how it spreads and its symptoms. So guys, we must beware of the virus COVID-19. That's why we must wear masks and use sanitizer to stay safe. And then COVID-19, for instance, can be caught earlier by checking your temperature twice a day. So for the temperature, we can get in 37.5 Celsius or above for we can detect for the virus. So a fever can be an early sign of the disease. If you have a fever, cough, or difficulty breathing, seek treatment right away at the hospital as well. As COVID-19 is a contagious disease, you are not only risking yourself but also the community and all of the people by not seeking help immediately. Very, very dangerous. If you have the above symptoms, do call the health ministry's helplines for the proper advice on what to do. So if you have a symptom, any symptom what you got, like what I said, fever, cough, and difficulty breathing, you must call the health ministry helplines. Okay guys.
Hi, I am Rafi. I will talk about reschedule doctor appointments. Some experts are recommending that older adults who are at risk should cancel non-essential doctor appointments, including wellness visits. This is as there is a higher chance of exposure to various infectious disease at a hospital. If you need to collect your regular medications, please speak with your doctor to request for an extra month or two worth of supply so that you can reduce your hospital visits. Next, stay socially active. Although social distancing is the pillar of pandemic control, it could lead to social isolation, which is already a problem in the older population. Experts suggest switching to virtual meetings with friends and relatives with the benefit of social engagement in mind. This is possible with video chatting and apps like Skype and WhatsApp, and keeps you socially active without the risk of exposure to the coronavirus. Establish alternate ways to communicate with family and friends and stay socially connected. Lastly is maintain your daily routine. Social distancing may affect routines in ways that can compromise the health and energy levels of the older adult. Maintaining good habits such as healthy eating, getting quality sleep, taking your supplements and medications on time, and exercising at home or in the garden is vitally important. Thank you.
Hi, my name is Muhammad Iqbal bin Muhammad Zahar. Today I'm going to talk about tips COVID-19. Firstly, seek help if you are stressed. If you are feeling overwhelmed with emotion like sadness, depression, or anxiety, it is always critical to talk to someone and seek help. This emotion might be due to the stress and panic caused by the change in routine and adjustment you've had to make during this pandemic. There are very common feelings during the heightened period, so please seek attention for it immediately. The Health Ministry has set up at least on military center in each state to help improve outreach to the community and reintegration of people with mental health issue like stress, copy problem, which may be to be of help. Talking to family members and close friends who are good at listening can also help. And the second is support yourself. Take breaks from the overwhelming fake news and story going around on social media. Reading repeatedly about such news can be upsetting. Concentrate on taking care of yourself and focus on other activity at home that you enjoy. Connect with others and talk with family and friends about your concern and how you are feeling. Most of all, continue doing the things that keep you happy.